Okay, this is week 10, part 4, and still talking about therapeutic devices. So we have the laser, and the laser is also a type of atherectomy or actual removal of the plaque. The laser is an ultraviolet light. It works similar to the rotational atherectomy device, but instead of a burr, it is a laser that vaporizes the plaque. And again, it vaporizes it into small enough particles that they are safely absorbed by the body. Then we have the distal protection devices. Okay, so also known as, the one I'm most familiar with is the filter wire. So during an intervention, fragments of plaque or thrombus can break off and lodge downstream, so meaning they can cause an embolism. So they have developed distal protection devices. These are devices that catch the debris as it runs downstream. So one of these uses a balloon to block off the flow of blood, an occlusion balloon. Then all of that blood is trapped and then is sucked out with a suction catheter at the end of the procedure. And then the other one is uses a filter, and this is the one I'm most familiar with. This is a mesh bag, kind of like try to imagine a net that you would catch a butterfly in, a butterfly net. This is a mesh bag that is positioned distal to the lesion. So now when something breaks off, it is caught in the bag. Moving on to thrombectomy. So this is the removal of thrombus. And remember, thrombus is blood clot. Lysis means to break apart. So you need to know that suffix. Lysis means to break apart. So thrombolysis means to break apart a clot. So there are two types of thrombolysis. There is thrombectomy, which is also known as mechanical thrombolysis, the angiojet. And then there's pharmacological, which is using drugs to break up the clot. And brachytherapy. Brachytherapy is radiation therapy, like cancer treatments. They make what are called seeds that emit radiation. They are placed within a stent that has restenosed. This radiation kills the tissue and helps keep the stent from restenosing again. So again, this isn't cancer treatment, let me just clarify, but it is a form of radiation therapy that helps restenosis. Okay, moving on to the hemoximeter. Now, I just want to remind you that this week 10 follows the ARRT content specification. So again, I'm under equipment and instrumentation, and all I'm doing is just going down this list and just briefly hitting on all of these things. And so, we just finished up with therapeutic devices, brachytherapy, and now I'm moving on to patient assessment instrumentation, the hemoximeter. Here we are right here. So the hemoximeter is a machine that measures the amount of oxygen in blood samples taken from various locations within the heart. Samples are taken from both the right and left sides of the heart. This can detect a shunt. A cardiac shunt is an abnormal hole between the right and left side of the heart, and we have talked about that already, but this is just a review. The picture above demonstrates a shunt between the right and left atriums. This results in either a right to left shunt or a left to right shunt. It just depends on which way the blood is shunting. And this is a ventricular shunt, so again, a hole. So how does a hemoximeter diagnose a shunt? Well, if there is a right to left shunt between the atriums, then the oxygen saturation in the left atrium will be lower than normal because the right is the deoxygenated side, the left is the oxygenated side. So if it's moving from right to left, that means the deoxygenated blood is moving to the oxygenated side, which would taint the normal reading. And if there is a left to right shunt between the atriums, then the oxygen saturation in the right atrium will be higher than normal, so more than 80%. So that is how a hemoximeter diagnoses a shunt. Moving on to the ACT machine, ACT, activated clotting time. This is the machine that tells us how well the blood clots. We often give the patient heparin in the cath lab, especially during interventions, and so we need to make sure that the ACT is about 160 to 180 before pulling out the sheath. The Doppler pulse unit, this is the machine that detects the pulses when you cannot feel them. It works by using sound waves. The sound waves bounce off the artery and lets us hear the artery if we cannot feel it. The cardiac output computer, this is basically software, and it is, again, cardiac output, let's remember, is the amount of blood ejected from the left ventricle in 1 minute. So that's a term you have to know. In other words, how many liters per minute. There are 3 ways to calculate cardiac output: the Fick method, thermodilution, and angiographic. Most of these calculations are done by the cardiac output computer. And pulse oximetry. The pulse oximeter is that clippy thing that is placed on the finger. It could be placed on the earlobe or toe also. It measures the amount of oxygen in the blood. The normal range is 90 to 100%.